The UK is currently battling a new variant of SARS-CoV-2, the virus causing COVID-19, which was originally termed lineage B.1.1.7. The mutated strain, which was detected in November 2020, is pushing hospitals in the capital and southeast to the brink. One hospital in Essex has been forced to start managing oxygen supplies because of the number of coronavirus patients needing treatment. There is currently no evidence that the variant is more likely to cause severe disease or mortality, but it's thought to be up to 70% more transmissible than previous mutations. It is vital to heed the warning signs of COVID-19 and self-isolate or seek medical assistance to break the chain of transmission. What may come as a surprise is that you can spot COVID-19 on your nails and earlobe. This is because these points provide an insight into your blood oxygen levels. COVID-19 and its associated risks can cause your oxygen levels to plummet to alarming levels. You can monitor your oxygen levels using pulse oximeter, a simple, painless sensor, which shines a light on your nail or earlobe to work out how much oxygen is in your blood as a percentage of the total amount it can carry, out of 100, explains the COVID Symptom Study app. If you have COVID-19, your GP may give you an oximeter to use at home, explains the health body. It adds, be wary of buying a pulse oximeter online or relying on the oxygen monitoring function of a smartwatch, sometimes known as the SPO2 sensor, as these may not be accurate. How to use a pulse oximeter, according to the Symptom Study app, if you're normally healthy and your oxygen saturation falls less than 95%, take a few deep breaths and retake the reading. If it is between 92 and 94%, seek advice from your GP or call NHS 111, the health site warns. It adds, if it remains below 92%, visit the nearest accident emergency, or call 999 for an ambulance. Make sure you tell the medical team that you have or may have COVID-19. The main symptoms of coronavirus are, most people with coronavirus have at least one of these symptoms. Most people with coronavirus have at least one of these symptoms, explains the NHS. If you have any of the main symptoms of coronavirus, get a test to check if you have coronavirus as soon as possible. You and anyone you live with should stay at home and not have visitors until you get your test result. Only leave your home to have a test. Anyone in your support bubble should also stay at home if you have been in close contact with them since your symptoms started or during the 48 hours before they started. A support bubble is where someone who lives alone or just with their children can meet people from one other household. There is currently no specific treatment for coronavirus, COVID-19, but you can often ease the symptoms at home until you recover. However, if you have a high temperature, it can help to get lots of rest and drink plenty of fluids. Water is best to avoid dehydration, advises the NHS.